Omicron is resulting in so many cases. Ontario has had to scale back testing and brace for impact across the health sector and beyond. That's the bad news. But is it possible that it's also bringing some light at the end of the tunnel? Let's ask. In Ontario's capital city, Dr. Prabhat Jha, epidemiologist at the University of Toronto's Dalalana School of Public Health and director of the Centre for Global Health Research at St. Michael's Hospital. Hi, Dr. Jha.
Yes, good morning.
Thank you so much for being with us. We've got lots of questions for you. And I wanted to start with what percentage of COVID cases in Ontario are caused by Omicron right now?
The vast majority, not just in Ontario, but pretty much worldwide, Omicron has displaced the earlier variant, which was Delta, which was the dominant variant.
Has this been a surprise with the pandemic, within the pandemic?
It was a surprise in the sense that the doubling time of Omicron and its infectiousness was remarkable. Uh, we had expected patterns that were similar to what we had seen in with Delta, but Omicron is far more infectious than Delta for what now appears to be for biologic reasons. But there's also some good news with the biologic properties of Omicron in that it doesn't seem to affect the lungs as much as the upper airways, the mouth and nose, for example. And
We're going
so
to get into that in
therefore,
just a second.
Mhm.
But I wanted to just kind of talk about what's the situation that's happening right now, just to understand, I guess, the science a little bit better. Omicron has been reported to be less severe than Delta, as you mentioned, more contagious. Can you speak to the science of why that is?
Well, the what appears to be the case is that the Omicron virus is better at entering the cells in the upper part of the airway, meaning in the mouth and throat. So think about it as a burglar in an apartment who's trying to get into various buildings, and the key seems to fit very well in some apartments, but less so in others. So it's the same. The key that the virus has to enter the cell seems to be very good at getting into the upper airways, but conversely, that seems to be less effective in getting into the lower airways, into the lungs. So therefore, it doesn't seem to cause as much disease. What we also know is that it appears that Omicron might have what's called a higher viral load, meaning the amount of virus that is being shed is greater than was the case with Delta. That's not fully clear, but there's some suggestion. And the last component of why it's more transmissible is that a greater proportion of people who have Omicron might have asymptomatic infection, so they just don't know that they're spreading it. So if you put those factors together, it may help account for why Omicron really took off, and it took off so quickly.
Dr. Jha, I think when I heard of 10,000 cases, my mind, I just couldn't comprehend what was happening, and the numbers have gone up since. We've gone through many different waves during this pandemic, but how has this wave differed from earlier waves in infections caused and hospitalization and death rates?
Well, it's a far bigger wave in terms of cases. In fact, the estimates for Ontario, for example, peaking at somewhere around over 10,000 cases a day, are probably an underestimate because the testing has also changed. What we do know is that it appears, and this is consistent with now evidence in the UK or other places that have about 10 days advance pandemics to ours, that Omicron seems to cause a fair number of cases, but relatively less hospitalizations or deaths than the earlier waves. Now, that's not to say that Omicron is mild. That is always a dangerous distinction. I mean, you remember when the cigarette industry used to say, oh, some cigarettes are mild. Well, they're not. And there's no such thing as a menthol equivalent of Omicron. Omicron is less severe on the individual, but it's more transmissible. So in that sense, it's certainly not a milder condition. And as you know, the challenge we're mostly facing here in Ontario and worldwide is a simple one. The number of cases is so large that even a lower proportion of those getting hospitalized has overwhelmed our healthcare system. And the numbers being admitted to hospitals, often for very short durations, is so large that our health system is really trying to deal with such an extraordinary pressure on admissions. So that's the main challenge that we have today.
I want to go back to something that you just said because I think within this wave with Omicron, we have been hearing a lot of people saying that Omicron is milder than the other variants, Delta. Why is it important to distinguish that it's not mildness that we should be looking at?
Because mildness there's two parameters that you need to think about. One is how severe is it on the individual, and it is true Omicron seems to be less severe on the individual than, let's say, the Delta variant, but it's more transmissible. So in fact, you've got increased risk of spreading it to potentially more vulnerable populations, such as grandparents or the immunocompromised. So by that sense, Omicron certainly isn't mild. And I hesitate to have that label, partly because my own experience is that the cigarette industry tried to label cigarettes mild, and we know they never were. So
Hospitalizations for COVID are an all-time high with this wave of Omicron. Some jurisdictions have had to reintroduce some lockdown measures. But by your estimate, is this pandemic transitioning to be endemic?
well, by definition, all pandemics do eventually have to become endemic. Now, it's a question of when. So if we go back in time to the great 1918-19 pandemic, the best sense is, well, how did that incredible influenza pandemic, which might have killed perhaps 60 to 100 million people worldwide, how did it end? The suggestion is that a more transmissible but milder flu strain replaced it and then became basically the basis for seasonal flu. So we don't know yet whether Omicron is the last hurrah of this pandemic. We certainly would hope so, but we can't rely on wishful thinking. We have to understand the science behind it and track it. The fact that it is causing a lot more infection means, and much of that is less severe infection, does mean more of the population will get immunized. And the hope is the combination of Omicron infection plus vaccination will be sufficient to ward off future waves. But we simply do not know that yet. There might be something worse than Omicron that comes around. And we know what conditions will lead to that, which is basically unvaccinated parts of the world that become variant factories. But we don't know yet whether this is the end of the pandemic phase in moving into an endemic phase. We all hope so, but we simply don't know yet.
I want to follow up with what you just said because in some countries, populations haven't even received a dose of the vaccine, and in other countries, people are on the fourth. They're getting a fourth booster. When we talk about new variants, could new variants be what threaten this trajectory from moving from a pandemic to become endemic?
Well, certainly so. We knew that Omicron would come back to bite us in some sense, or we could predict. And the reason is the world has left large parts of its population unvaccinated. So now there are more third doses than first doses delivered in developing countries. So parts of Africa have less than 5% of their population vaccinated. So if you think about the conditions where variants can produce, it's really in unvaccinated or undervaccinated populations with lots of transmission and lots of mixing. In the Omicron case, it was also the combination of immunocompromised people with HIV in South Africa that probably contributed. So those conditions still exist. And the only way out of or the only the best way out of preventing future variants is to vaccinate adults worldwide. And on that area, the world has very much failed. I believe that the numbers of people that should have been vaccinated by now is far below what we had all hoped globally.
In Ontario, we're now offering a fourth booster for vulnerable populations. How effective are boosters against Omicron?
Well, boosters appear to be effective at preventing Omicron infections. That's the good news. But we have to step back a bit and realize that even 2 doses of the most of the standard vaccines provide excellent protection against hospitalizations and deaths. So if enough people are getting those, then the pressure on our hospitals and particularly on the intensive care units should be far less. So what I had hoped would be a strategy that the government would follow was more focused third doses or boosters for immunocompromised people. So my mother, for example, is elderly and is immunocompromised, so she's a candidate for a third dose. So they are effective, but as we've seen, because Omicron is so infectious, they're only a small break on the numbers of cases. They're really effective against hospitalizations. This is vaccines, hospitalizations, and deaths. So the strategy has to be very much to try to make sure the elder populations in particular and the immunocompromised are the ones that get third doses. And if we, as we hope, coronavirus becomes seasonal, meaning it's not a pandemic, but it just recurs every season, then we're looking at something like a flu shot program where every year you'll have to get an updated equivalent of a flu shot, perhaps a combination of a flu shot and a COVID shot. Every year will be needed. But that we don't know. That is still the months and years ahead. And hopefully that'll be guided by very good science and good clinical trials that tell us what type of combinations work to keep basically an endemic virus under control.
And just to go back to, variants that might pop up, we're hearing of variants in France, the IHU, and whatever other variants might come up in the future. Will those variants likely to follow Omicron's trend of being less severe but more contagious?
That would be the hope, and broadly in evolutionary theory, you think that's the business of the virus. The virus's only job is to replicate. So if it can evolve to become quite infectious, but very less lethal, meaning that it just has more customers and it infects and moves on. If you kill your host, then it's not as an efficient a virus. But we don't know whether from the large populations that are still unvaccinated, a potentially lethal variant might occur. And that would be the worst combination, something that is as infectious as Omicron or even more infectious, plus has the greater lethality. And that would be then really a terrible situation. So we don't know which way. You don't bet on which directions evolution might take. I think the best strategy remains try to vaccinate adults worldwide to try to decrease the number of places where variants could pop up.
You said that we don't know which way it could take. It could go become less severe, or it could become more severe. Politics aside, what are the way are you? Again, some populations haven't even had one vaccine. Do you see fourth vaccines being necessary to handle whatever new variants might come along?
I don't, and simply because the science has not supported that. I know Israel has moved to adding fourth vaccines, but I think the science is reasonably limited. I'd like to see more scientific evidence, more clinical trials, and more lab studies that a fourth dose is generally a good strategy. In particular, immunocompromised people like they're on cancer drugs or they're on drugs that suppress their immune system, or they have HIV, there might be an argument for a fourth dose. But for the vast majority of others, there's just really isn't sufficient scientific evidence to justify a fourth dose.
In Ontario alone, we're seeing a lot of people. Yesterday, for example, I take public transit, and for the first time ever, I saw that one of the trains was canceled, and the message was a staff shortage. We're seeing shortages with essential workers. Personally, on a personal level, it seems as if everyone seems to know someone now who has COVID. Um, if you do get Omicron, will an Omicron infection provide lifelong immunity to COVID?
Again, we do not know this. The hope is that it would, for the same reasons that I mentioned. If it's an infection that gives you a reasonably high viral load, meaning you get a good whack of the virus, and it gets into your cells easily, then hopefully it triggers a stronger immune response. Some of the early lab studies suggest that the immune response from Omicron is greater than that from Delta, which is a good sign, meaning it'll give you more prolonged immunity. But we simply do not know whether it's going to give you lifelong immunity. It's unlikely because very few vaccines give you lifelong immunity. Measles is one. But for example, the seasonal flu vaccine does not give you lifelong immunity. That's the reason we have to take a different flu shot every year, because the virus has mutated. So we don't know that yet. The hope is the combination of Omicron plus vaccines would mean that when future waves come, they would be smaller, they would be just in focal areas, and they could be handled by the things we know to do, which is vaccines, contact tracing, masks, and testing. And those strategies would be more amenable to handling local pandemics or local epidemics, not a worldwide pandemic.
I've heard there's been many stories of people who have been vaccine hesitant, who have made the argument that if they did get COVID, they would become immune to COVID. Therefore, they wouldn't need to get the vaccine. What does the science show?
The science certainly says that it's really risky to think, okay, I'm going to go get infected, or you don't want to go to an Omicron kissing party or something and say, okay, that's the way I'm going to get immunity. Remember, it varies by age. Mostly in younger adults, yes, you could think it will cause less disease than would be the earlier version, but we don't know how protective it is against other variants. We'll know that in time. And we also know very clearly that getting 2 vaccine doses, for the 2 vaccines doses like the adenovirus or the mRNA vaccines, that provides excellent protection against hospitalizations or deaths. So we should use the things we know are trustworthy and not speculate that you can somehow get Omicron infected and you'll become Superman and be immune from further infections. That's just wishful thinking, really.
Some jurisdictions, including Ontario, seem to be foregoing PCR tests. Are you concerned that we might not get an accurate picture of infection rates in the population without these tests?
I am concerned because whenever testing requirements change, then following the data on using testing is just not reliable or not as reliable. So what is needed is to try to get additional types of evidence. And we have our national antibody study, the ABC study underway, which is sampling about 8,000 Canadians and surveying them over time to look at antibody responses. So our kits just went out yesterday, and hopefully within a few weeks, we'll have evidence on whether the people who've been vaccinated have some protection against Omicron, and if so, how much, and also what types of vaccine doses help protect against Omicron. So you need that kind of additional evidence, particularly when the testing data become less reliable. I always say that when you think about how to fight the pandemic, you should think about, okay, I'm getting into a taxi, and you would feel assured if the driver was vaccinated and was wearing a mask and had been tested. But then you would not be so sure if they put on a blindfold and said, I'm going to drive. So governments are the same. They need data to be able to see what is ahead and to respond to the pandemic. So we have to put data as one of the key pillars of the response. And by that measure, I think Canada has done not nearly as well. The UK has excellent data. Denmark has excellent data. Canada, less so in terms of being able to fight the pandemic.
I think you mentioned masks there, and at the beginning of the pandemic, a lot of people were relying on cloth masks. Right now, we've been hearing a lot about switching those masks into N95 masks, respirator masks. Is that what you see going forward? Is that what the science shows going forward is what we should be using?
Well, because Omicron is more infectious, it does make sense to be prudent and use higher uh, higher quality masks, including the N95s. But I think, I mean, given their limited availability, they should be reserved for really frontline staff. So certainly hospital staff, but also frontline transit workers, school teachers, grocery clerks. Those are the people who see a lot of people a day. For the rest of us who don't have that kind of risky exposure, I think using the standard masks that are used, and in some cases, I suggest people double mask, uh, should be sufficient. But the N95 certainly should be used by the higher risk occupations.
I wanted to ask you in our final moments, your Twitter handle, Count the Dead,
Mhm.
is a Twitter handle that's going to stay in my mind for a very long time. But there is a significance behind it. What is the story behind that, your Twitter handle?
Well, my professional career has very much been obsessed with quantifying premature mortality worldwide, particularly in low-income countries. So I count the dead to help the living is the way I would characterize it. If you what By getting good data on what is killing people, you can figure out what are the strategies to reduce premature mortality. And so I thought just having my name would be a bit more of a boring Twitter handle. So I've kept with Count the Dead so far.
Dr. Jha, thank you so much for spending some time with us. I understand your schedule is so busy, and we really do appreciate you helping us understand the science behind Omicron better. Thank you so much.
Happy to help. Stay safe.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.